That's unfortunate because the whole sacrament, the whole covenant of being with the doctor is having them look you in the eyes and realize you're there for each other. That process is going to go away. We will, within the workflow of doctors, be able, with your help, allow physicians to take care of patients, gather the information while they're doing it, and will destroy the upcoding that has hurt Medicare Advantage and other programs in a similar fashion. The IT infrastructure that's going to change promises to improve a lot of things. We're going to cut fraud, waste, and abuse. Mr. President, we announced with the DOJ 2 weeks ago a $15 billion bust. $15 billion. It's a multinational criminal syndicate based primarily, we believe, in the Soviet Union, in Russia. And what they did was hack using beneficiary numbers into the system. We'll be able to stop that because of a system that Amy has put together and the wonderful work of Amy Brandt, who has a fraud war room using this kind of technology, because we'll know who you are and who your doctor is. We can block this. We're going to have remarkable advances in how consumers can use their own records. We'll have beneficiaries be able to get MAHA advice and prevention tips and even be able to nudge them and reward them perhaps for that. And all this comes back to one fundamental issue, Mr. President, which is leadership. I think 60 people, the biggest, the best, the willing, came forward because of your leadership, because you weren't going to take no for an answer, and they know it. We are building a robust and safe, I emphasize that, safe system. It's going to protect the data better than we could have imagined. We're going to be able to accomplish goals that all of us wished from day one that would be in place. These pledges are now confirmed. They're signed in public. You have therefore empowered Americans to own their property, which is their medical records. Let me introduce Amy Gleason. She is acting director of DOJ, U.S. Digital Service as well, and was actually the brilliant woman who pulled together the pieces of this puzzle with so many members of the audience. Amy Gleason.
Good afternoon. First, I would like to thank President Trump for his leadership in this area, and Secretary Kennedy and Administrator Oz for driving this work with clarity and urgency. I would also like to thank my colleagues who have been instrumental to this, and we've worked a lot of late nights and hard times on this, and it would not have been possible without them. I want to start today with my daughter Morgan, who's here in the audience. If you'd please stand up. I am so inspired and energized by your strength every day. And we also have two other patients here, Randy and Tom, who have been very inspiring. Thank you for being here today. You're why this all matters. Let me start talking about my daughter's history. So 15 years ago, she was diagnosed with a rare disease. She was 11 years old, and she started showing mysterious symptoms. Over the last year and a half after that, she saw the country's best doctors, but she still continued to get worse.